Sickle cell disease. Definition. Sickle cell disease is a group of inheriting disorder of red blood cells. If you had it, there is problem with your hemoglobin. Hemoglobin is a protein in a red blood cell that carries oxygen throughout the body. In sickle cell disease, hemoglobin has rigid bad forms within red blood cells. This changes the shape of red blood cells.
We are back. Sickle cell disease. Apparently, my hematology videos are the most loved, so we will continue. Okay, sickle cell disease is a problem or a disease when your blood cells, your red blood cells, now look like a sickle. And no, I'm not talking about communism, okay? Sickle cell disease is prevalent in sub-Saharan Africa. So they call this part of Africa the Sahara, and beneath it is the sub-Saharan Africa. So here we have the sickle cell disease problem. Why is that?
Application in nursing. The job of the nurse is to provide patient care with scientific principles so that by knowing everything related to anemia, educate the patient about his pathology, supply oxygen since the level of hemoglobin has dropped, and this means that there is no enough oxygenation in the tissues. Administration of medicines such as folic acid, ferrous sulfate, B12 vitamin, explain the adverse effects, monitor daily body weight, monitor the intake of liquids administered and unlimited, skin care, care with blood transfusion if necessary.
This is Sarah, registerednursern.com, and in this video, I'm going to be going over sickle cell anemia. And this video is part of an NCLEX review series over hematology. And as always, don't forget to access the free quiz at the end of this video to test you on this condition. So let's get started. What is sickle cell anemia? This is where a patient has abnormal hemoglobin on their red blood cell. And the type of hemoglobin that we're talking about is hemoglobin S. Now, the normal type of hemoglobin is hemoglobin A. Patients who have hemoglobin A, they don't have this condition. Only the ones who have hemoglobin S. And the thing to remember about hemoglobin S is that it is very sensitive to low amounts of oxygen in the body. So anything that causes the body to increase its demands for oxygen, like going to a higher altitude, infection, dehydration, things like that will cause these red blood cells to change their shape. And when they change their shape, they will become...
Pros and cons. Pros. Treatment. The only cure for sickle disease is bone marrow or stem cell transplantation, because these transplants are risky and can have serious side effects. They are usually only used in children with severe sickle cell disease. Cons. Symptoms. People with sickle cell disease begin to have signs of the disease during the first year of life, usually around 5 months of age. The first symptoms may include painful swelling of the hands and feet, fatigue or irritability due to anemia, a yellowish color of the skin.
Sickle cell disease, also called sickle cell anemia, or just sickle cell, is a genetic disease where red blood cells can take the shape of a crescent, or sickle, and that change allows them to be more easily destroyed, causing anemia, among other things. Sickle cell disease is caused by defective hemoglobin, which is the oxygen-carrying protein in red blood cells. Hemoglobin is actually made up of 4 peptide chains, each bound to a heme group. Different hemoglobins have different combinations of these chains. Hemoglobin A, or HbA, made up of 2 alpha globin and 2 beta globin peptide chains, is the primary hemoglobin affected in sickle cell. Specifically, the beta globin chains end up misshapen. And this is because of a mutation in the beta globin gene, or HBB gene. Sickle cell is an autosomal recessive disease, so a mutation in both copies of the beta globin gene is needed to get the disease. If the person had
Issue applied in Ecuador. Approximately 5% of the world population carries genes that cause hemoglobinopathies, including sickle cell disease and thalassemia. The hemoglobinopathies are genetic block disease due to inheritance of genes mutants of hemoglobin by both parents, which are generally healthy.
Our football team's like #1 in the nation. So the band has to. Music is.
The first time I actually found out she had a disease was when we were at a contest, and I saw her get kind of weak, and we were marching off the field, and I saw her pass out.
She's always just like pushed herself, and she's just works so hard. Most of our teens, they don't want to be different. They don't want to have to stop and take breaks because it makes them look different or feel different. It is a chronic disease, and it is very vital to their care that they have a place that they can go that understands their disease. St. Jude is one of those places.
St. Jude Children's Research Hospital is primarily known as a place that treats children with cancer, but really from our start, we have had a program to treat children with sickle cell disease. It was a devastating disease at that time, but we've made great strides in improving the.
Conclusion. Sickle cell anemia is a hereditary form of anemia, a disease characterized by an insufficiency of healthy red blood cells to transport an adequate level of oxygen through the body.
In humans, a condition we call sickle cell anemia afflicts red blood cells, and more specifically the hemoglobin molecules found inside red blood cells. So in individuals who have sickle cell anemia, the hemoglobin molecules